Hartford HealthCare is leading the way with a unique program for lung cancer screening that is saving lives. Joining us live today is Dr. J. Tyler Vanbacker, thoracic surgeon with the Hartford HealthCare Cancer Institute at the Hospital of Central Connecticut and Mid-State Medical Center. Doctor, thank you for your time this morning.
Thank you for having me.
Of course. Let's talk about first who is eligible for lung cancer screening.
Absolutely. So the most recent guidelines have included people who are 50 to 80 years old, and those who are either current smokers or who have quit within the last 15 years, and patients or people who have smoked at least a pack a day for 20 years or a half pack for 40 years, what we call 20 pack years.
Okay.
So those are the general guidelines in terms of who can be screened.
And what do we mean by screened? What exactly is that?
Absolutely. So the way a lung cancer screening goes is usually people will talk with either their primary care provider or a provider about the risks and the benefits. And then if they qualify and are deemed someone who should be screened, then they'll get a referral for a very low dose lung cancer screening CT scan. And it's a quick CT scan, takes maybe 10 to 15 minutes, that looks at the lungs and makes sure that there aren't any concerning nodules or areas that need to be addressed. The benefit of it is really that, if we catch something early, lung cancer or other types of cancers can be very treatable.
Okay, well, that's hopeful, right? And I understand that Hartford HealthCare's Cancer Institute has a very unique lung cancer screening program. So tell us about the work that you guys do there.
Absolutely. So in addition to the lung cancer screening, we have an opportunity where some patients may qualify for what we call a single anesthetic diagnose, stage, and treat procedure, where if there's a concerning lung nodule, we will try and expedite the timeline to try and shrink the time from the time of diagnosis to the time of a treatment. So we can biopsy the nodule, and if it comes back as a cancer, we can actually stage that cancer, meaning try and determine what stage a person is while they're still asleep. And if they turn out to be a very early stage cancer, then we can resect that cancer at the same time.
Wow. And as a surgeon who is around this quite often, how hopeful are you about this screening and saving lives?
Absolutely. So the benefit of screening really shows in studies that it reduces the risk of dying by about 20% from lung cancer. So unfortunately right now we're only screening about 6% of the eligible population, which is much lower than mammography or colonoscopy, which have had stronger recommendations for a longer time. So we're really trying to make the push to help reduce the risk of dying of lung cancer. It's the most deadly type of lung cancer in terms of number of deaths per year.
Wow. And I have to ask this before I let you go here. I feel as though more and more people have quit smoking or they aren't smoking, but now we're seeing a lot of people use e-cigarettes, vaping. What is it looking like in your line of work?
Absolutely. So especially during the COVID pandemic, but also currently, what we've seen is folks who are younger, so especially in the teenage years or the 20 years, who are not necessarily picking up cigarettes like their parents or maybe grandparents used to, but they will switch to go with vaping. And these, while they're sold as kind of an idea where it's not as toxic because you're not inhaling, you're inhaling the vapor. It's not, you don't have as many carcinogens, that it still is quite caustic to the lungs and can cause what we call blebs, or little blisters to form on the lungs. They can cause, when patients come to me with a lung collapse, one of the first things I ask is, do you smoke or do you vape? And sometimes the answer is, really, we need to stop that in order to help reduce the risk of the lung collapsing.
Yeah, all good information here, Doctor. Thank you for your time. We appreciate it.
Thank you very much for having me.
Of course, for more information, you can visit hartfordhealthcare.org/getchecked.